So I spent the last 10 years before I came here in clinical training and then as a junior faculty member focusing my career on studying interstitial lung diseases, which is a broad category of lung diseases, many of which are characterized by excessive scarring or fibrosis in the lungs. So I was caring for patients with those disorders and doing research in pulmonary fibrosis and interstitial lung diseases. The opportunity came up here to come here and start a program because there really wasn't a focused program for interstitial lung disease patients here before. It's been gradually building since I arrived here. You know, the first part of that was really trying to establish the clinical program. So making sure that pulmonologists in the surrounding community and other clinicians within the lifespan community know that I'm here and here to see those patients. These are a complex group of lung diseases, and the diagnosis and management can often be difficult. And so one of the things that we emphasize in the field is using a multidisciplinary approach. So bringing together a pulmonologist like myself, pathologists who look at the biopsies of lung tissue that we take, radiologists who have expertise in diagnosing chest diseases, as well as rheumatologists who are specialists in autoimmune diseases. We kind of all come together as a group and discuss these clinical cases to try to come up with the most accurate diagnosis, the best treatment plan for these patients. So it was kind of building the infrastructure to optimally care for these patients. The complementary approach doing clinical research with that program is starting to collect specimens, biological specimens from patients that are seen, patients with interstitial lung diseases. So we collect blood and ultimately collecting samples of lung fluid from these patients to then take to the lab and start to study so we can understand these diseases better. My goal here was to do research with patient-oriented research and research using clinical samples. And so it takes time to build that up because you have to bring in patients first. One of the other things that really drew me to this job was that there's a new dean here at the medical school, Jack Elias, who came a few years ago and is really a world expert in lung biology and also has done a lot of research in pulmonary fibrosis and interstitial lung diseases over the years. He runs a basic science lab where one of the areas that they focus on is pulmonary fibrosis and understanding at a cellular level and using animal models what's happening in this disease. What are the mechanisms that are driving the development of pulmonary fibrosis or scarring in the lungs? And I've done research in those lines myself over the last several years doing basic science research. But my main focus here is to collect patient samples and collect data on patients and then use those samples to try to understand the disease better and try to apply some human disease relevance to the observations that they make in bench research. So sort of translating the findings they make using studies with cells and with animal studies to make sure that those are really relevant for the human disease.